Managing patients with sensory and developmental disorders at the dental recare appointment. Tips for parents and dental providers. Hi, my name is Amy Palladino, and I have been a registered dental hygienist for the past 31 years in Connecticut. I also have a BS in elementary education and worked in a pediatric dental office for 6 years. I've been working in a family dental practice for the past 20 years, which treats a large number of children of all ages and abilities. According to the American Academy of Pediatrics, 1 in 6 children in the United States have 1 or more developmental disabilities or delays. Some may even exist comorbidly with one another. Examples include, but are not limited to, ADHD, ASD, hearing loss, cerebral palsy, learning disabilities such as dyslexia and other academic impairments. Given these stats, the likelihood of treating a patient with one of these conditions during any given week is high. In order to make the dental recare visit as smooth as possible for all involved, I've compiled a list of 5 tips to guide dental treatment with the goal of achieving as successful a visit as possible. First, have an understanding and familiarity with the disability and any anxiety the individual and their parent or caregiver may have about dental visits. Allow the caregiver in the room during the visit and pay attention to verbal and nonverbal needs of both. 2, have an open mind and heart. You'll need more of your emotional skills than clinical to get close to your patient, both physically and emotionally. You need to build trust. To do this, you can get into their world before they will enter yours. Take time to get to know them. Sometimes that's all you may achieve on the first visit, but it's absolutely priceless and will be the key to your success at future visits. Learn their interests, what comforts them, what they enjoy, what makes them smile, and also what is intolerable for them, what upsets them, such as lights, sounds, textures, and taste, proximity, oral habits. Parents will be very helpful in providing information on this and might bring some of their favorite comforting devices to the visit. 3, allow extra time for the appointment and be sure that it is scheduled at a time of day that is best for the patient. A new 1-step per visit approach is required. Tell, show, and do in a calming demeanor, and have the parents practice the routine at home by playing dentist. Use lots of positive reinforcement and praise. You could also make sure you incorporate breaks for them if needed. Give them an index card with the word break that they could hold up. And 4, use distraction and calming devices, such as fidget toys, koosh balls, stress balls, silly putty. That can help with calming, anxiety, focus, and attention. Be flexible with patient positioning in the chair. They may not want to recline all the way. You can use a blanket or the lead apron to help soothe. They may also need frequent breaks. So give them the ability to move about, sit up, work with them standing up, whatever works for them. Music can be helpful, but some may prefer no sound or music on, but ask them what their preferences are for music at the onset of the appointment. That can help. And lastly, the 5th tip is to be aware of each patient's unique forms of communication. Examples might include hearing difficulties, language processing challenges. They may struggle with following directions and need multiple repetition. Echolalia, or the repetition of noises and phrases, may present themselves. Also, tics, motor and vocal, may be present in individuals with ASD and Tourette syndrome. The bonds that are created with these patients can be so rewarding. Thank you for taking the time to watch this segment, and I hope you found it helpful and were able to take away some tips to implement in your practice or as a caregiver for dental visits.